views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.
Good day, and welcome to Ability Radio. I am your host, Angus Drigo. The radio broadcast is brought to you by the Disability Rights Center of the Virgin Islands. We are a protection and advocacy agency providing legal support and services for individuals with disabilities, ensuring that their rights are not violated, that there's no abuse. And we also provide services to families, individual children with disabilities, IEP representation, and the like. Our offices are in Frederiksted, next to the old Kmart West on the left side if you're heading to Frederiksted. Our number there is 772-1200. And we're also in St. Thomas, St. Havenside. And our number there is 776-4303. Today we have Miss Caribel Leyva-Romero. She's Community Engagement Program Coordinator for the Veterans Health Administration. I think I got that right? Okay.
Yep.
And I want to emphasize Health Administration because there are, I think, 3 separate branches. And
Yep.
welcome. Tell us a little bit about yourself. And you're here in St. Croix.
Yep.
Trying to put together a coalition.
Exactly.
And the floor is yours.
So, hi everyone that is hearing this radio transmission today. I'm a social worker for profession, but here at the VA Caribbean Healthcare System and the Community Engagement and Partnership Coordinator. I have been with the VA for 2 years now, and part of the work that I do is to connect with the community, and the base of that connection with the community is for suicide prevention. And we have had the opportunity for the last year to start connections with the USVI as part of the scope of service that we do at the VA Caribbean, that is Puerto Rico and USVI veterans. So prior to that, I worked on the local PR Department of Health with rape victims, and community organizations. So that's my background, at least for prior to attend and to start working with the VA.
Okay. Before we go into a little bit more detail on the collaborative group that you're trying to put together, tell us a little bit more about the divisions within the federal, the Veterans Administration.
So it is important to clarify that the Department of Veterans Affairs actually have 3 administrations. That's the Benefit Administration that we call BBA, the Healthcare Administration that I work for, and the Cemetery Administration. So there are 3 sister administrations under the same department, and one to another depends and eligibility and stuff to get the services. So when we talk about health care administration, they are divided through regional, or what we call VISN, Veteran Integrated Service. And part of the importance is that it has all the medical services, the mental health services, among other stuff, under the healthcare system. And the program that I represent, that is suicide prevention, have multiple divisions. And that the specific division under the program of suicide prevention, that every facility from the healthcare system has one that covers all the coverage of that facility, also have some initiative. And one of that initiative is the one that I'm the role one, the Community Engagement and Partnership Coordinator, that at the same time responds to the community-based interventions for suicide prevention under the Suicide Prevention Office, what we call VACA, that is the main administration office in Washington, D.C. So that's kind of a little bit of how it's structured, at least for suicide prevention, because that's the kind of the same thing that happens for the medical part and other areas. And suicide prevention is under mental health. So that's at the same time, even though it's under mental health, at the end, everyone in the healthcare system and everyone in the Department of Health, the Department of Veterans Affairs, need to do suicide prevention because it's the one clinical priority for the whole Department of Veterans Affairs. So that's who we are. In this role, my job is to get the spread of the word, that importance of everyone getting involved in the suicide prevention initiative and awareness, to do some initiative between and within the community and where the community is at. So that's me, and that's the program that I work with.
You mentioned that even your area of expertise or your area of concern is suicide and prevention, but it also encompasses all the other medical components.
Yeah.
Can you just go into that a little bit? Because the idea about having you come by is not just to talk about the suicide prevention, which is important, but it can lead to other service areas for veterans on the island, because I know it's difficult for a lot of veterans to get services even when they go to Puerto Rico.
Yeah. So part of the public health approach that it's working through this program is that identify those service member and veterans, and to see what is in the community and what is not, what we have as VA and what we don't have, and how we can help with that gap with the community itself, and to get the resources, the information, the educational materials, and to put the power within the community to start also doing job with them. Public health approach at the end is to recognize what are the needs of the people. And when we respond to the needs of the people, we actually do suicide prevention. Why? Because if I have someone that doesn't have the medical clinical care appropriately, probably having situation with the medical part, and let's say chronic pain, let's say PTSD, let's say chronic diseases, and a person, for example, is not working or not covering that need, at the end, probably is going to have risk factors. And those risk factors can develop or can impulse some suicidal ideation. And that's why we look at it as a public health approach. Because at the end, we not necessarily need to say, we are doing suicide prevention work. No, we are responding to the needs of the veteran and try to have them the best care that they need or that they deserve. There's some lag and some gaps, reality within the system. And that's why it's important to see, okay, if we don't have it, what is out there in the community that probably could help that person. And we like to get on board the family members as well, because part of the importance of is the support systems. And some of our veterans have a lot of support systems, but other doesn't have. And that also can be a risk factor. And again, that's healthcare, public health approach, because we get involved at everyone. So that's why we cannot see the suicide prevention as a solo part. We need to see suicide prevention when we respond to the needs of a person, when we connect that person with the services that we require and that they need at that moment. And also understand that not everything is going to be resolved, but what we can do as a community together, all the components, to get that risk factors as low as possible. So,
thank you for mentioning that. I know that folks out there listening might want to know, well, is this tied into any kind of funding sources so that the local community can tap into? You want to expand a little bit on that?
Yeah. So the program is not come from funding. We can do as CEPC, Community Engagement and Partnership Coordinator, is to, if an organization or a coalition identify a possible funds or some fund is identified there that probably the coalition can be benefit, we can collaborate with information, and the coalition if decide to get that fund, then we have to also, as federal employee, we have to step aside for that process. But for example, if they need data from the VA, how many veterans there are, how many services are getting or not getting, that's part of the collaboration process within the coalition that we can do. But at this moment, there are some fundings out there, but not the CBISP, Community-Based Intervention for Suicide Prevention itself, comes with money. And we know that that can be challenging for the community work. And that's kind of how we can manage and see how we can manage to do something that doesn't require a lot of money expenses, but that voluntary service and that initiative to create and to develop the organizations to work and to add the work of helping the veterans within the already services that they have, not necessarily create new services. So that's the spectrum under the position. And at the end is get that strength to the community to act and come together to what we have, what we can do with what we have. So,
okay. I know that you have two groups already established in Puerto Rico, one in urban, one in rural areas.
Yeah.
We don't have that dynamic in the VI, so it's a little bit unique. Can you explain now, since you've been here, what are your first steps and what have you done in terms of getting that coalition built up?
Well, part of the CBISP is that they will try to approach this model of the three priorities through different levels. So we have been working with what we call state level or territory level initiative that we have the opportunity to have and host on December 2023 a mental health summit in San Croix. And recently on May, we had the opportunity to connect and create a mental health summit in San Thomas. And from those two mental health summit, I had the opportunity to connect with local organizations. And the idea that I started doing on January from this year is to start giving that follow-up with those organizations and get them to know me. And obviously, I get to get me to know what the organizations are doing within VI and what, if so, something are willing or want to connect with the veterans in the community and explain the idea, their priorities. Do you see yourself working with this? And after various meetings, we got multiple organizations to join and to create a committee that is going to be developed on our community coalition. Because my work could be in two ways. Create coalitions from the scratch, like we are building one in San Croix right now, or join existing coalitions. And the approach of joining coalition was the first that I thought that was going to help because already organization working in the community. But at the end, the organization wanted to collaborate together, to do something together because everyone can bring something to the table. My role within this group is get them together, be a subject matter expert to planning, to creating needs assessments, let's say create an actual action plan to do goals, objectives, time frames. That's my role within the coalition and bring the expertise on suicide prevention. That's what we are doing. Actually, right now in August, we are doing a meeting. We did a meeting. And hopefully in the next couple of months, we are going to be doing some actions within the community of San Croix as San Croix, because as Angus shared with you, the public, San Croix is an island and we don't have that division and that difference. And that is the importance of role like mine to be and to meet the community where the community is at. I'm not here to impose anything, or the VA is not to impose how to do the stuff, but how you think the organizations and the community can do the stuff. Okay, so I join that efforts and I join with my knowledge. Okay, if we want to do health fairs, for example, how we can do it to manage and to connect and to reach out to the veterans that are not connected, because that's where this is coming from. There's a lot of veterans that are not connected to the VA. Either they are not eligible, and that's another whole topic with eligibility, or they decide to not be connected with the VA, and that's okay. But the statistic nationally, not necessarily the VI wants, is that the most people or the most veterans that are dying by suicide because of the health needs and stuff are the ones that are not connected with the VA. So how I can reach them? How can I work with them? How I can connect them with the VA or with the community resources? So that's the base from where this is coming. We need to reach out to those veterans that are not connected. We need to reach out to those veterans that are probably isolated in their houses. And what a best way to actually connect that with those veterans, with your neighbors, with your family members, and with the community itself. At the end, we are not everywhere. We don't have people everywhere, but there are people everywhere. So if we get everyone to have the knowledge, the basic knowledge of how I can help someone in needs, then we have a community ready for crisis, to crisis management. So at least we connect them to the right services. That's kind of the whole thing of the whole work that we are trying to do right now in St. Croix, and hopefully we get some outcomes. We know that the community works doesn't have results immediate. We know that the community works takes time. And me not being from the VI, it's also another step that we have to work with. So I encourage everyone to get to know me. And we are neighbors. We are Caribbeans, Highlanders. And the idea is to get together and save lives.
Thank you for that. You mentioned St. Croix a lot, but you're duplicating this on St. Thomas as well.
That's
right?
the idea.
Okay. The other question I had was, with all of this collaboration thing in place, you mentioned groups, family members. How does somebody get involved if they want to get involved in this coalition?
Well, at this moment, one of the invitations that I have is to start looking if there's already existing strategies in their communities. Start asking, how can I help someone that is alone? How can I connect with someone? It's my neighbor a veteran? It's my neighbor a service member? Is my coworker a veteran? I never asked them. Start breaking the idea that we are not available or we cannot ask a simple question that's, have you ever served? And that simple question can bring you a lot of information. So at this moment, we are in the process of building that coalition. So probably we're going to be doing some stuff in the next month. So be there pending what's going to happen in St. Croix. But you don't have to wait until the coalition actually is working to start connecting with people and to make sure that if you see someone that is at risk, help them and connect them with the right services. I mean, at the end of the time, it's like a campaign that the VA has. Don't wait, reach out. Well, the same thing I say to the people. Don't wait till that something is happening and reach out to the veteran that probably is in need. You're gonna be you can be a change for that person. So
I want to go back to what you said about having the differences in culture and the differences in how the islands are set up. Mm-hmm. For us, though, coming here, what have you witnessed as the hindrances or what we can do differently, since you've already done this in Puerto Rico, to make this coalition work and really establish it quickly? Because it's really a need.
I think that even though the culture is different, what I have experienced is that the enthusiasm of doing something for the community, it's kind of the same. Let me explain. When I started to do this work 2 years ago, I have the opportunity to meet with other organizations that are already working, but they're working in their silos. I mean, like silos. In their silos, mm-hmm. And they're not communicating with themselves. Right. So I have been seeing that this is happening as well here, but the response of acting or to start doing from the community, it has been faster from Puerto Rico. And that's something very interesting. I have, so for some organizations, from one of the coalitions that I'm working in with a survey in Puerto Rico, we ended up finishing the survey after a year of starting to work.
Wow.
For example, because of the calendar, too many things happening at the same time, etc. And the first time that I was here in San Croix, it was on December 23, and we are talking less than a year that we already have a committee. That says something. That says that community wants to work, organization wants to go together, and the sense of community itself is being very humble for me to see in the USVI. So that's something that I take up on really, really serious, and feel very humbled to be welcome as I have been. I mean, because I have been felt very welcome in the USVI, and that's good too.
Okay. What's after you form the coalition and you have the groups together and you say you could lend your expertise and your support to it, how often would you come back? How do you keep the momentum of keeping groups together? Because I can tell you it's very difficult to do.
Yeah.
To get people to come out. Because this is all a labor of love, really, because nobody's getting paid to do this.
Yep.
But I like the idea about having all these integrated services within these groups so that you can provide a central hub basically for services to veterans. So how are you gonna be able to keep that? I mean, you have the experience in Puerto Rico, certainly. Tell us how we can prosper in that regard.
Yeah, the idea is to do in this phase, start to doing regular meetings. So we have been having some middle individuals. So we had to figure it out in that action plan to make sure that we do regular meetings to get the job done and identify realistic goals and identify realistic people that is going to do the job. And my plan, I'm assigned to work with the USVI. I'm assigned to work as a CPC for the USVI. So I have funding to travel. That's a good thing because that means that I can plan to at least every other month to come to the St. Croix. But that doesn't mean, or St. Thomas, but that doesn't mean that between those months, we are not going to be meeting.
Right.
We have the opportunity to keep doing the virtual job and we can keep going and be in person to then the follow-ups. So that's going to be like kind of a hybrid work.
Right.
And since from the beginning, we need to think about sustainability. That if tomorrow I'm not here, tomorrow I leave the position, let's say, or the position is another person, that the group's still there. That the group has so much, a great milestones and the great force that it can keep going with or without someone, not necessarily not me only. Let's say someone from the group left also, but the group keeps. So that's the idea. How we're going to do it, we're in the building of it, but let's make sure, I mean, at least I'm going to make sure that I'm going to be here at least every other month, or let's see how it happens with the new fiscal year, but how it's going to be the currency, but that's going to be there. That's going to be there.
How can somebody wants to get involved? How do they go about doing that?
So
your contact or when the local group is established, how is anybody going to know or get all that information?
Well, at this moment, anyone can contact me through my email or my cell phone. My VA cell phone is 939-649-1813. My email is more long, so if you get the number, let me say it again, 939-649-1813. That's my working phone. That's going to be available if you are interested. If I gave you that seed in your mind that I want to see what it's going to be doing in St. Croix, give me a call. And definitely I want to add you to the group that we already are working with. And anyone can join.
Also, you want to give us the suicide hotline number too.
Yeah. So September is the Suicide Prevention Awareness Month. So we need to spread the word out there. The 988 is the lifeline for everyone. But if you press the option 1, That's the veteran crisis line, and we can connect that veteran with the service needs. That's something that we do follow up, those consults that receive. That's mental health crisis and mental health needs lifelines. And please remember that suicide prevention awareness is everybody's business, and suicide prevention, it is preventable.
Thank you so much, Caribel, for coming out. I really appreciate it. A lot of information. This program is gonna be on our website, drcvi.org. You can go in there and listen to it when it's aired. If you want to hear it again for the information, you visit our website. I want to thank you for coming out. Appreciate it. All the way from Puerto Rico.
No, thank you
Caribel,
for having me.
Thank you. Yeah, thank you for coming out. Angus Drigo signing off for Ability Radio. You can reach us 772-1200, 340 that is, and 340-776-4303 on St. Thomas. Thank you for listening.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.